Hi, welcome back to Keep Moving Uncut. I'm Dr. Tiffaney Hunter and I'm a doctor of physical therapy, and this is Keep Moving Uncut. It's uncut because I don't do any editing, but it's a channel all about keeping you healthy, strong, fit, and pain-free. So today we're going to be talking about sciatica. I get so many concerns, probably 60% a week, about sciatica. So today we're going to talk about what it is, why it flares up, can it continue to flare up, and what it means for you, okay? So first I want to talk to you a little bit over here. I want you to come and look at these muscles, because sciatica is all about a nerve that's going through an area and it's getting pinched and it's pressure being put on it, and it comes along here. So if you start having pain and it's right along here, or if you push in that area of the back of your hip and you feel that pain, then it's probably sciatica. Now, a lot of times people ask me, can it keep coming back? The answer is yes. Why does it keep coming back? Probably because you're doing the same things that you're doing when it flared up in the first place. So when it comes to that, it's not always about lifting or trying to lift less. It's a lot of times about your posture. So what I mean when I say posture is that sometimes when you're standing, but you have a curve in your back. Well, the lumbar spine, if you look at this picture right here, you have a natural curve in your lower back. You want to keep that natural curve there. So a lot of times if you're hunched over, you're not keeping that natural curve. So you're doing the opposite of what your body wants to do. When you're picking something up, you don't want to lean forward because, again, your back is curved. You want to keep that upright posture and squat. So a lot of times you want to squat. If you're sitting long periods of time, you want to try not to sit long periods of time. And if you're able to get up and walk around throughout the day, if you have a job where you're typing a lot, or if you're doing a lot of schoolwork, get up and move around. Don't just sit straight. And if you can, when you're driving long distances, stop, pull over, get out of the car, and walk around. Now with that, those are all important things about posture that you can do to help your posture. But sometimes you do have to sit down long periods of time and you don't know what else you can do. So I'm going to tell you about a roll that you can use in your lower back to keep that posture there if you do have to drive long periods of time. So if you'll look, I want you to sit here, and I want to stop for a moment and grab a towel. So let's see. And this is definitely uncut because we would have had this ready. Let's grab a bigger one. So this is a regular bath towel, and you can roll it and use this in the lower part of your back. So if you're rolling this, I would take it and roll it this way. Just like that. And then while you're driving, put that right there in that natural curve, and that's gonna give you some support. Same thing if you're sitting in a chair at home, put that there. Another thing to remember is when you are sitting in a chair is to scoot back and make sure the back of your hips are as close to the back of that seat as possible. And then you can put that towel roll right there. Also, McKinsey makes one of these that's already made, and it's a McKinsey roll that you can make for your lower back. Now, once you know you have sciatica and you're having trouble working with it, you're doing everything you can do, you're trying not to bend incorrectly, you're squatting, and you're making sure that you're not heavy lifting, there's an exercise that I really love, and it looks like this. You're going to get on a flat surface. You don't need the pillow there. And you're going to come down and gently move up. And you're gonna hold that position just a few seconds and come back down. Now, when you first begin, you may just come up just like this and down. And what you're doing is you're doing an extension position, also by McKinsey. And basically, you're gonna hope that as you're doing these motions, you should feel little by little that pain is alleviated. After you've done these a few times, you can come up a little bit higher, but again, the main thing is little by little, that pain is alleviated. I do want to also tell you that if you're doing those exercises and you notice the pain goes up and is increasing, you want to stop doing them right away. So that's one thing that I want to tell you that helps with that sciatica, and that's a way of knowing some things you can do to help out. Thank you.